All right, so hello and welcome back. I am Corinne,
Hello, I'm Mallory.
and we are here again to tell you all things pandemic related. Just a friendly reminder, as always, I am not a doctor. She is not a doctor. So we are just people that like science and we like to tell you about science. So talk to your doctor if you have a medical concern.
So, what are we learning about today?
Today, we are finally getting to the big one. We are reviewing the mRNA COVID-19 vaccines. So, really, how they work and kind of a lot of the concerns that a lot of people have been, worrying about. Please, 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 if you didn't watch the last video, check that out. It's about how vaccines and the immune system work in general. So, that might give you background information. And I did link to podcast episodes. They're from Science Versus, which I love. They did a really great job of explaining the vaccines, and they have a lot of experts that they interviewed. And I actually remember we listened to one of these last summer that was talking about the mRNA vaccine. And I was just like, oh my gosh, this is the coolest thing ever. So listen to them. They're very informative and I love them.
Okay, so regarding mRNA vaccines, which ones exist and how effective are they?
Mm-hmm. So currently in the United States, we have two mRNA vaccines for COVID-19. So we have the Pfizer vaccine, which is 95% effective against infection with mild symptoms. And we have the Moderna vaccine, which is 94% effective against infection with mild symptoms. One common misunderstanding that I actually learned about in this is that people think that 95% efficacy means that in the clinical trial, 5% of people that get the vaccine are going to get COVID, and that is not true. The actual percentage of vaccinated people in the trials who got COVID-19 was about 100 times less than that. So if you get the vaccine, you are actually hypothetically going to get COVID 0.04% of the time. What that 95% means is that the vaccinated people are 95% less likely to get COVID compared to the control group who was not vaccinated. So, in other words, the vaccinated people in the clinical trials are 20 times less likely than the control group to get COVID 19. But I think the most important thing in terms of both of these vaccines is that they are both 100% effective against severe infection, which would require hospitalization, and they are 100% effective against death from COVID-19. So they're both like great.
All right, so how do they work?
So the concept of mRNA vaccines is actually really smart and simple. We're going to go back to like general biology to talk about how does RNA work. We call this the central dogma of biology. Big idea. In our bodies, we have our DNA, which then gets turned into mRNA, which we call a message, which then gets sent to the ribosome. And the ribosome is going to make proteins through the process called translation. We're just using that same process with the mRNA vaccine. The coronavirus has those spike proteins on the surface. So we've seen that picture before. And those spike proteins on the surface are binding to our cells, which causes the infection. Back in January of 2020, so very early on in the pandemic, scientists were able to isolate the virus and they were able to determine the genome. So really, they were able to figure out all the genes that make up the virus. So for the vaccine, what they did is they isolated just the gene that makes the spike protein. So for the sense of this, this is our spike protein. This is our crown. The mRNA that makes just this spike protein is injected into your bodies. Your cells take it in. They don't know any better. They start turning that mRNA into the spike protein. They say, I'm going to just make a bunch of these because I have the instructions that tell me we need to make a lot of these. Your body then detects the spike protein. It says, hey, I recognize this. It was not here before. And it causes that immune response against just the spike protein. So look back at last week if you need to look at, immune responses again. As time goes on, the mRNA that said, hey, make this spike protein, it is naturally degraded in your body. And we now have those antibodies that are formed just against the spike protein. For both of the mRNA vaccines, you need your second dose, depending on which brand you get. It's either 21 to 28 days later to make sure that you have that full immune response against the spike protein. And then approximately 7 to 14 days after your second dose, whichever one that you get, you are considered fully immune against the virus. And at that point, if your body encounters the actual virus, it will recognize the spike protein. It says, hey, this virus has the spike protein. I don't like that spike protein. And it's going to attack it. It's going to neutralize it before it can infect you.
Okay. Can you tell us a little bit about the side effects of these vaccines?
The common side effects are what we would expect from any other sort of vaccine. So those would be fatigue, headache, fever, specifically after the second dose is when people are seeing these, as well as pain at the injection site, which can feel warm to the touch or swollen. All of these symptoms are just signs of an immune response. And these are very common. This is just saying that the immune system is working. It's saying, hey, I want to start making these proteins. I need to start defending the body. And it can remember the virus for the second time. The side effects usually start within a day or two of getting the vaccine. They might affect your ability to do daily activities, but they'll go away after a couple of days. One thing that I did find is that you can take fever reducers or pain meds after you get your vaccine for the symptoms, but do not take them before. Don't say, oh, I heard that this is going to be bad. I'm going to take these in preparation, because you don't want to trigger anti-inflammatory responses, because that might dampen your immune system to the vaccine. So you can take them after, don't take them before.
All right. And how can you go about getting one?
So depending on which state that you are in, each state kind of has a different timeline and a different set of requirements for the different phases. There's going to be a link that I'll specify down below from the CDC that has both a vaccine finder website as well as a state health department link. So there will be a screenshot here somewhere. Both of them are going to help you determine when and where you can get the vaccine.
All right. So there's a lot of information and there's a lot of opinions floating around. So why don't we just take some time to talk about common concerns and maybe some myths that we can debunk.
Perfect.
So first, what would you say to people who think that they rushed the development and there's no way that these vaccines can be safe?
So this is what I've heard most of the concerns about. And actually, researchers have been studying and working with mRNA vaccines for decades, since like the 1990s. The cool thing about these is that they are non-infectious. You cannot get sick from mRNA, and you have a very quick manufacturing time. The reason why it happened so quickly is because pretty much all of the pharmaceutical companies all over the world were working on developing that vaccine for the COVID-19 infection, because obviously this was a worldwide pandemic. The emergency situation allowed for an emergency response, but that does not mean that these companies bypass any safety protocols, and that means that they still did all of the proper adequate testing. The mRNA vaccines have the same rigorous safety and effectiveness standards that every other vaccine in the United States goes through. The only COVID-19 vaccines that the FDA will make available to the United States are ones that have met the standards. And in general, between both of these vaccines, over 70,000 trial participants were studied and monitored during this process. And they're still doing monitoring of all of the people that have gotten the vaccines. And that's what we consider like phase 4 trials. We're just constantly monitoring people that have gotten the vaccines.
Okay, and how would you respond to the idea that the vaccine doesn't work because it doesn't reduce virus spread?
We already know that there is evidence for the COVID-19 vaccine that they are highly effective in preventing severe illness, hospitalization, and death for those who get it. And what we know is that an immunologist that I read somewhere has quoted saying, vaccines have always decreased transmission, so giving it to another person. What they should be saying is that the clinical trials were not designed to test for asymptomatic infection, but there's every biological reason in the world to believe that they will reduce asymptomatic transmission. So it is assumed, based on the way that all other vaccines work, is that if it's preventing you from getting sick, you are also less likely to give it to someone else. The best evidence that vaccines do prevent transmission is a study in Israel that they've been doing. So Israel is very far ahead in their vaccine rates. Researchers saw an 89% drop in asymptomatic infection among a group compared to unvaccinated comparison. They have not published this yet, but this is what they've seen so far. So while asymptomatic infection does not measure transmission directly, experts say that if there's no virus present in your body, it's probably going to prevent transmission. So we are pretty much sure that it's not causing transmission. They just need formal testing for this.
Should you get vaccinated if you've already had COVID?
Mm-hmm. So the CDC is currently recommended that if you have been infected by the coronavirus, you should be vaccinated with the 2 doses of the vaccine. So either Pfizer or Moderna. But you should wait until after you have experienced your symptoms. And they say generally about 90 days after your diagnosis. And the reason why is that we don't have enough information to say, if you have natural protection, if you've had COVID-19, we want to make sure that you have full immunity against a second infection. So people should not get vaccinated if you are in quarantine after exposure or if you currently have COVID-19 symptoms, but yes, you should still get the vaccine.
What about the concern that the new variants of COVID aren't stopped by these current vaccines that we have?
Mm-hmm. So the way I like to think about these different types of variants is back to this silly crown example. So let's say the regular coronavirus has this as their spike protein, and let's say that the new variants, instead of a crown, they have a witch hat. I have lots of props in my house. So maybe their spike protein is now that hat. So for the last few months, there has been concern about the number of different types of variants that are being discovered. So these new mutated versions of the virus, and they're concerned that if the vaccine only prevents against this spike protein, maybe it won't recognize this spike protein, and there's no point in taking the vaccine. This is actually a really easy fix. It's not an easy fix for me, but it is an easy fix for the scientists. So we have surveillance all around the globe. We are currently looking for any of these new variants. We are recognizing these new variants. And what they're doing is they're determining, are the vaccines still effective against these variants? Let's say that they do find a new variant that does come out. The vaccine companies can quickly alter the vaccine. And the good news is that if you alter the vaccine, you do not have to redo the large scale clinical trials. Because really any alterations is just changing the mRNA and saying, okay, instead of the crown, make the witch hat, go after that one instead. So essentially you're just changing a couple of amino acids in the protein, and it's going to be fine.
And how would you respond to people's concerns that there are severe side effects of the COVID-19 vaccines?
Mm-hmm. So we know that there's, those short-term mild side effects that we talked about. They're going to go away soon enough. We know that about 15% of people that have gotten the vaccine have those short-lived symptoms, whether it's pain at the injection site or a site rash. 50% developed different side effects such as headache, chills, fatigue, muscle pain, or fever that lasted a day or two. But again, these are like the most extreme of the side effects. Keep in mind that these are just indicators that your immune system is working. They are making a response to fight against the virus. And one thing I did read is don't be worried if you don't get side effects. It doesn't mean that the vaccine is not working. You just have a different response compared to other people.
What about long-term effects of the COVID-19 vaccines?
Mm-hmm. So in the history of all vaccines, yes, there have been a few vaccines that did have side effects that required scientists to pull back and say, wait, we're not ready to release this yet. When these events did happen, the onset was within 8 weeks of when you got the vaccine. So 8 weeks after. That was the longest that it took for a response to occur. And I watched this interview with Dr. Fauci, And he said that any quote unquote long-term effects generally happen between 30 to 45 days after the vaccine trial ends. So that's why the FDA said that to make this emergency use authorization, to say like it's an emergency, we're using this, you have to wait 60 days after people in the trial were vaccinated with their last dose. And Dr. Fauci also said he has never, ever, ever seen a vaccine where, like, let's say you get vaccinated and there's a toxic effect years later, and that's with any vaccine. So he said there's no reason for us to believe that there would be, long-term effects like 3 years down the road.
So, should we continue to wear masks once we've gotten our COVID vaccine?
Mm-hmm. So you still do need to wear a mask after getting vaccinated because, first of all, you do not have full immunity until 2 weeks after your second dose. So you still want to make sure that you are being protected at that moment. And again, while the vaccine might prevent us from getting sick, we are still a little bit unsure about whether you can still transmit the virus to others, but we're going to talk about that in a second. Until we know a little bit more, they say, continue using these precautions, wear your mask, social distance, wash your hands.
What would you say to those who are concerned that more people will die as a result of negative side effects of the COVID vaccine than if they were to actually get the virus?
Okay. So I know that on social media right now is, people saying that COVID-19 has a mortality rate of 1% to 2%. You shouldn't get vaccinated because there's such a high survival rate anyways. But just keeping in mind that 1% mortality rate is still 10 times more lethal than the seasonal flu. In addition, the mortality rate can vary widely and it's influenced by sex, age, underlying health conditions. And again, some people that get the vaccine might have an immune response, but it is nothing more serious or life-threatening than getting COVID itself. You cannot get a COVID infection from the COVID-19 vaccine. It's just mRNA. It cannot get you sick. And again, it's important to realize that getting the vaccine is not just about surviving COVID-19. It's about preventing the spread of the virus, and preventing infection can lead to long-term negative health effects. So like we talked about long COVID before, you don't want to get that. And while no vaccine is 100% effective, it is still better than not getting a vaccine in the first place because the benefits outweigh the risks in healthy people.
And what would you say to the concern that the COVID-19 vaccine was developed to control the general population either through microchip tracking or nanotransducers in our brains?
Okay, so there's no vaccine microchip, and the vaccine is not going to track people. It's not going to gather any personal information into a database. I'm more worried about the Alexa that can overhear me. I hope she doesn't turn on right now. So this myth actually started after Bill Gates from the Gates Foundation was talking about a digital certificate of vaccine records. So he was saying, like, let's document all of the people that get vaccinated digitally. And he was not talking about a microchip, not saying like, oh, you have one in your body and this is how we know. But it was kind of just saying like, we need to keep a documentation of who is getting the vaccine. So you are not being microchipped. They are not tracking you in any way. So it is okay.
And what about the belief that COVID-19 vaccines will alter people's DNA?
Okay. So not true. The mRNA vaccine, again, it just tells your cells in your body how to make a protein, and that protein triggers an immune response. Injecting the mRNA into your body will not interact in any way. It will not do anything to your DNA. And your human cells are going to break down that mRNA very soon after they finish the instructions. So it's not going to affect your DNA in any way.
Okay. And what about the concern that COVID-19 vaccines cause infertility or miscarriage?
So this is an interesting one that I was reading about. So there's this disinformation campaign that is, again, going online, and it is claiming that antibodies to the spike protein of the COVID-19 virus produced in these vaccines are going to somehow bind to placental proteins, and it will prevent pregnancy. And the person that started this was a former scientist, and he has anti-vaccine views. These postings are not scientifically plausible. The COVID-19 infection is not linked to any infertility. Antibodies to the spike protein have not been linked to infertility after the infection. So there's no scientific reason that if you were to get the vaccine against the same spike proteins, that there would be a link to infertility. And again, there's no formal studies, but we do have evidence of people that had COVID-19 while pregnant. Pregnant people do have a higher risk of hospitalization due to COVID-19 infection, but there is no evidence that it increases miscarriage rates. So it is all okay.
Of the vaccines, is there one that's better or one that's the best?
So no matter which vaccine you get, the Advisory Committee on Immunization Practices has basically said that there is no preference between any of the vaccines. Generally, the outlook is get vaccinated as soon as you can when it's your turn. It does not matter which vaccine is available. And really, that's how the pandemic is going to end. A lot of people getting vaccinated.
Will we need to get another vaccine in the future?
I know that one of the concerns is trying to figure out how long this immune protection by the vaccines will actually last. Really, what it's going to be is kind of like a long-term study. It's going to be periodic blood draws from volunteers who are going to say, okay, what are your antibody levels looking like? But a decline in antibodies doesn't mean that you don't have protection. It just means that you're not making them right now. Really, what's going to happen is that you're going to have to start seeing like, oh, wow, a lot of people that were vaccinated are now getting sick. And then it might just come down to like getting another booster shot, like reminding your immune system, hey, don't forget, we need to protect against this virus.
Should we be worried about an allergic reaction?
Allergic reactions to any injected vaccine or drugs are possible, but they are very, very, very extremely rare. The vaccines are always administered in a setting where there are healthcare providers that can treat any allergic reactions that would develop unexpectedly. So even if you don't know if you're allergic, what they do is they make you wait about 15 minutes in like the waiting area. In case you do have a reaction, they can do something about it. People don't need to be concerned about the vaccine if they're allergic to latex or eggs or any other food allergies. And again, most people do not need to worry about an allergic reaction. If you do have a history of severe allergic reaction or allergies to vaccine ingredients, talk specifically with your doctor about should you get the vaccine.
All right, and then kind of a broader question. Why does all of this matter?
So in general, there was a poll in late February that said 44% of US adults are still on the fence or unlikely to be vaccinated. Of that 44, 22% said that they wanted to wait and see how does it work. 7% said that they would only get a vaccine if it was absolutely required. And 15% said that they would definitely not get a vaccine. And I guess the concern about this is this could translate to a longer recovery time of the country. Because again, we talked about that herd immunity. We're probably going to need between 80 to 85% of the population to have some level of immunity for the pandemic to end. So really, that's kind of like why this series is happening, these video series. We all want to get out of this sooner. None of us like living like this. And the more real information that people get, instead of just, misinformation from the internet, a lot less scary it's going to be to get the vaccine, and you're more likely to get it.
All right, well, why don't we leave off with some good news?
Yes. So currently, as of the end of March 2021, in the United States, 27% of the population has been given at least one vaccine dose, and 14.7% of the population are completely vaccinated. That equates to 137 million vaccines being administered in the United States. And again, once you are fully vaccinated, which is about 2 weeks after your second dose, you can officially gather indoors with fully vaccinated people without wearing a mask. Woo! You can gather indoors with unvaccinated people from other households. So like if you go visit your family, they are not vaccinated, but you are, you can go see them, assuming that none of those people have an increased risk of severe illness from COVID-19. And if you've been around, so again, if you are fully vaccinated, you've been around someone who had COVID-19, you do not need to isolate or get tested unless you have symptoms. And also, I guess a fun fact that I learned in this, Staples and Office Depot are allowing you to get free laminations of your fully completed vaccine card so that way you can keep it and present it. And the CDC does recommend just taking a picture of your vaccine card as a backup in case they need the information or in case you lose it and you need the information. So overall, thank you for turning in. If you want personal tales of vaccination, talk to me, talk to a friend, talk to someone that has been vaccinated. If you want like real person stories instead of just trial stats. I know I could read stats all day, but it's a lot easier and it's more comforting to ask someone like, hey, how are you feeling after you got your vaccine? I know that I personally, anything that I had after the vaccine, I was like, can you get a calf cramp from COVID-19 shot? And even though I had been running, that's the reason why. But, it's good to talk to someone else and see, okay, it's not that bad. Or you can talk to your doctor. But in general, next week, we're going to talk about the viral vector COVID-19 vaccines. And again, if you have any specific questions or want more information about anything that we mentioned here, like please let me know and I can look into that for future episodes. So thanks to you for all tuning in, and we'll see you next week.
And thanks to you.
Thanks. All right. Bye-bye.
Right. Next time. Bye.